No, you must have completed your award in working in health and social care training. Now, we're going to talk to you about care induction. Care induction is part of your introduction in working in health and social care, in care home, nursing home, or NHS. Part of your care induction, you have list of step-by-step, list of proficiency you need to meet in order for you to be safe, understand your role, or be more active in your role according to health and social care regulation. When we talk about Care Act, when we talk about Health and Social Care Regulation 2008. So now it's about promoting evidence-based care, making your patients, your clients, or the service user safe. You need this induction. Induction starts from you knowing the manager, who is the manager of your workplace, who is your leader, who is your team leader, what does the team leader do, what is their role. Also, you also have induction pack that involves they giving you step by step of activities that happen in your care organization. Let you know where the fire service, fire training, whenever the fire training takes place. Also know the fire assembly, know who is the fire marshal, also know where the toilet, where you need to have your break, what time is your break, what time you need to start your shift, and what time you finish, and what are the shift pattern. Maybe if you have choices, you don't want to do early, you want to do late, or you want to do night, or you want to do long day. So these are part of your induction awareness. Another bigger part of your induction is care certificate training. You need to complete the care certificate between 2, 6, 12 months of your job as a healthcare assistant, band 2 or band 3. So along the line, you're completing your care certificate. If you take advantage, talk about your mandatory care training. So mandatory care training usually be between 10 to 20 module or units of courses to cover. When we talk about infection control, safeguarding adults and children, health and safety, people moving and handling, or medication, safe medication awareness, different kind of training that actually gives you more evidence-based skills and awareness or compliance that will help you to be more confident in the care you're going to be offering your patients. Depends on where you work. Some your client, they call them service user. They can also call them maybe patient, depending on where you work. So these are the things you need to find out. At the same time, you need to also know what are the development stages, what are the opportunity, what are your pay, what is extra shift, or you want to register for bank shift, bank staff, to be bank staff at the same time you're being full-time, or you want to change from full-time to bank staff. So bank staff is like a unit that looks like agents, that look like agency job within your organization where you work. So it's also give you opportunity to ask questions. Also understand when we talk about reflective practice. So you also ask your organization about reflective practice. These are some of the activity you do in order for you to engage with your member of team. Helps you to engage with member of team, knowing what you can say, and having the confidence to explain about some of your patients that are difficult, or your opportunity to talk about what kind of training you want to get so that you can be able to manage particular patient. So if you work in mental health now, it might be opportunities for you to talk about therapeutic management training, or you want to talk about learning disability awareness training. You know, these are other area you can be able to express yourself really. So you will also know who is your supervisor at work. So induction awareness in care, when we talk about care induction, is a full package where you complete all the necessary steps for you to be able to do your job and understand your role as a healthcare assistant. So you also know what is your title. Is it healthcare assistant, support worker, or nursing assistant? So there are different name badge you're going to be seeing. So where you know where you're going to also get your name badge as well. Also know what uniform you're going to be wearing. Also know, get used to your staff as well. Your team, their names, what they like, what they don't like, what they dislike, getting used to your patient room. They introduce you to different kind of patients in the building. Know where they have their breakfast, lunch, activity room, and also know how you can be able to get all those things your patient, maybe where they put their clothes, the toilet they're allowed to use, staff toilet, and all those things. So care induction is very important. Care induction is part of the organization induction. If you stop this job, you start different job, you're still going to do induction again. Yes, just like in educational sense, they give you induction, introduction, how to start your course. So the same thing care induction is about. So if you need more training when we talk about level, if you are done level 2, you've done level 3, or you want to enroll, register for level 4 with us, or you have challenges at your workplace, you might be working for private, you want to move to NHS, or you work for NHS, you want to move to private, or you want to work with agency, let us know. We can always support you. We always support our graduates. Or just register for work-based education and certification program, where we can give you full package of resilience and certification in working in health and social care.